we got to get you on camera there. I forget what you look like.
Okay, we are set to go. So can I, first of all, get a motion to approve the minutes of our prior committee meeting? We have Claudia is not on the committee, but clearly Susan, motion by Susan, seconded by Brad McGowan. All those in favor? Aye. D, are you ready, D?
Yes, can you hear me?
Great. Good. Ready to start.
Okay. The first item we have on our agenda is permission to extend the aiding services assistant temporary position until May 1st, 2020 at 20 hours a week utilizing district funding in the amount of $2,750, which is 100% funding. The person is currently helping us deliver meals, work at the meal site, and make client contacts during this time.
Wonderful.
I'll make that motion.
Go ahead, by Edna, seconded by Supervisor McGowan. Any discussion? No discussion. All those in favor?
Aye.
Number 2.
Permission to appropriate $2,750 from our deferred revenues into the district category to cover the salary and the fringe for the above position.
We get a motion to put it on the floor. Supervisor Beatty, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Right. Number 3.
Permission to increase our April through March 2019-2020 ISIP contract with the Hamilton County Public Health from $35,000 to $45,000 to cover additional services that they have provided during that time.
Can we get a motion to put that on the floor, please? We
Make the motion.
have Supervisor Shepler and seconded by Supervisor Beatty. Any discussion? All those in favor?
Aye.
Number,
Peter, I had a question.
go ahead. Yeah.
What specific additional services were provided that indicated a $10,000 increase?
They provide personal care services, PC1 and PC2, so they do shopping, housekeeping, hands-on care, and the reason is they just, instead of another contractor being utilized, our clients wanted to use Hamilton County Public Health, so the money is just going to be going to them to cover the extra clients and costs that they have.
So we go up 25% approximately. So would this be a regular occurrence? I mean, I'm just confused. Is this a one-time situation where?
It's a one-time situation, yes. It may increase next year depending on which agency our clients decide to utilize.
Oh, okay. All
Right.
right.
Any further discussion? Brad McGowan?
Yes, thank you. This is an increase with contract with the Hamilton County Public Nursing Services. But doesn't Hamilton County pay for that?
Yes, it doesn't affect Warren County at all, but because the contract is done through us, I have to get approval from the Warren County Board to approve it.
But actually Hamilton County pays for it.
Yes.
All right, thank you.
Seems like a no-brainer to me.
I agree.
All those in favor?
Aye.
All right.
Opposed? None. Okay. Anything else, Dee?
Nope, we don't have anything else this time.
Great. Thank you very much, Dee. I do appreciate it. You have a good day. Okay.
You too.
Rob York, mental health. Go for it.
Yes, good morning, everyone. I have first item is a resolution request to amend an existing intermunicipal agreement that we currently hold with Saratoga County. The current agreement is for the sharing of some services provided by Northern Rivers, Parsons Child and Family Center, They provide a home-based crisis intervention program and a mobile crisis, mental health mobile crisis program. And now we also want to include the Assertive Community Treatment Team, which is a community-based, multidisciplinary mental health outreach team that works with our most high-need individuals. And they have 48 slots available in that program, and our counties, Warren and Washington, are currently using about 38 of those slots. And for fiscal viability reasons, we would also like to share this program with Saratoga County. It will help us to maintain the program.
Great. Thank you, Rob. Can we get a motion and get that on the floor, please? Supervisor Conover, seconded by Supervisor Bruno. Any discussion? All those in favor?
Aye.
Go ahead, Rob.
Okay, thank you very much. I also wanted just to provide some program updates. Staff of the Office of Community Services have been working from home since March 17th. We're in touch with each other throughout the day, each day by email and calls, participating in conference calls with our providers and with the state agency partners. Staff will go into the office occasionally if there's something they need to do. They do their task and then they leave, go back home. One of the first tasks was that we wanted to ensure that there was mental health support information available on the county's COVID-19 website. So we did put that together and put some links out there, circulated some information on dealing with the stress of the COVID-19 and some self-care strategies. New York State has a toll-free COVID-19 support line, so we promoted that. Also made a targeted outreach to our public health staff with some of those resources, including some online guided exercises for stress reduction and mindfulness to help support those staff. In terms of the local provider system, we've been working very closely with our providers in terms of the impact on mental health and substance abuse services to the residents. For the most part, our clinical programs have been able to have clinicians working from home and connecting with their clientele via telephone or video conference telehealth means. As you may have obviously seen, recently Glens Falls Hospital did have to furlough some staff, and that did hit their behavioral health staff as well. Approximately 50% of their clinical staff for outpatient services were furloughed. They have ensured us that all staff are still being served by the reduced, some people have been reassigned to other clinicians who are reaching out telephonically to maintain the treatment connections. Anybody who's receiving medication management, those services are still available. The inpatient services are not affected. The emergency room, any crisis staffing, those were not part of the furlough. We're continuing to work with the hospital and our state agency, Office of Mental Health, to see if there are other options to try to bring staff back online as soon as possible. Some of the day programs in our system have had to close, obviously, but the staff in those programs are still working and reaching out, making sure clients are doing okay at home, that they have access to social determinant needs like food, medications, maintaining those types of things, and just emotional support as well. Let's see. Also, I just wanted to mention that I was contacted by Amy Drexel from the Office of Emergency Services with a request about setting up a virtual family assistance center to support grieving families, as we have seen some deaths occurring in the county. What we were able to do is we reached out and put together a small work group. Some of our providers, our mobile crisis services was an existing service that has staffing of clinicians available by telephone, and they offered to step up and be a first point of contact for these families. In addition to that outreach, if families choose to reach out to them, they would offer 1 or 2 support sessions with them, and then be able to refer them further for some additional emotional support and grief support. This service is specifically targeted to families who have lost a loved one to COVID, or also to families that maybe have a family member in a serious stage of illness. So the hospital has been working with us on this as well, so they are promoting that phone number to the families directly as they have them there. We're doing some outreach also to the nursing homes, and have also planned some outreach maybe to the faith-based community and funeral homes, but that's still in process. In addition to the phone contact with the clinicians, then we also developed some space on the website that you can link to from the helpful. It's on the COVID website, but then under the helpful resources, you can see a link to the Family Assistance Center, and there's some special resources on there specifically designed for this purpose. Okay, I think that was pretty much my updates on the programs. Any questions?
I'm maybe just a comment, Rob, but it would just seem to me that your organization will be stressed with people that are in trouble. I mean, when the very impersonal nature of how someone dies today due to COVID, the fact that the healthcare providers are totally garbed, and it just seems like a kind of a very sad and impersonal way for a family to have to lose a loved one. So I would think your services, hopefully this will end soon, but your services going forward, I'm sure will be called upon, and we appreciate your good efforts to make people a little more understanding of kind of life in general. So thank you, Robin.
Sure.
Anything else, Rob?
Then I just wanted to provide a few updates on the enacted budget, the 2021 enacted budget. There were a few things that we were watching in that regard in terms of the negotiations, and one of the most critical issues we felt that could be an impact to the county has to do with 100% cost shift to the county for the competency restoration costs. And for folks that have followed with the committee over the last few years, occasionally we have to come before the committee and ask to amend the budget to increase to cover these costs. Previously, it's been a 50% county, 50% state split. These are court-ordered examinations and something that we really have little control over, because we never know from year to year how many people will fall into this category of being ordered by a court for a competency examination that they fail. If they're at the felony level, they go to an inpatient mental health facility operated by the state. And the cost for the daily cost for that is close to $1,000 a day total. Under the previous arrangement, it was 50-50% split between state and the county. And under the enacted budget, those costs are now 100% county. I did just a quick look at the last 4 years, and our average costs over the last 4 years turned out to be $32,600. So thinking in terms of impact to the county, if you were to double that, about $65,000 a year would be the projected cost to the county. The last few years, we've budgeted at a 47. Previous to that, we were budgeted in the 30s. And 2 years ago, we had a chargeback cost of $92,000 in 1 year. So unfortunately, that did survive in the budget. There was a lot of our statewide association advocated strongly to oppose it, but to no avail.
Did Supervisor Beatty, did you have a question?
Yes, and more of a statement. This is just another example of these shifting of costs from Albany to the counties. And it is so disconcerting to see this example, which will probably cost us, using Mr. York's numbers, probably cost us an additional 32 to 35,000 extra a year. This is just one small example. And I am very concerned that you're going to see a number of state shifting costs that they previously would cover 50% or 40% or 60% of different items. And they're going to cut it way back to where the counties will be funding probably close to 100%. This is scary to me, okay? All these things are in the budget that no one even really sees. Thank you, Mr. York, for you seeing it and bringing it up. But there are numerous items in this year's budget that are going to shift costs to the counties from Albany. And so anybody in this room, all the supervisors, every single spending item that we have that is not mandatory or essential, we've got to look at with a microscope. And probably, in my opinion, I'm not gonna go for any of them unless it's an emergency or mandatory, because this is scary to me, and it goes over the head of most people. But 35,000, you're saying, no, it's only 35,000. Well, the reality is there's a number of items that are going to be shifted from Albany, from the state, supporting it, to the counties. And this is just one more example. Thank you. I had to get that off my chest, but it's a real concern of mine.
Great. Thank you, Doug. Rob, were you done? Or-
No, I have a few more items on it. Just in terms of the budget impact, another negative impact to our department is the New York State Office of Mental Health and the New York State Office for Substance Abuse Services did enact a 10% reduction in administration funding to the counties. So this is 10% cut in our admin funding that we get. It's approximately, our estimate is about $6,300 to our department. Also, we have a positive item in terms of continued funding of $60,000 for substance abuse services in the jail. And so we've been working with Sheriff LaFar and working on a program for some services that would help connect people as they're coming out of the jail to community-based treatment. Another positive item was $92,500 was included for the veterans peer-to-peer program. And that's something that Denise is working on out of the Veterans Office. It's a shared program with Washington County. And we were glad to see that funding was included. Those were the main items that I had that I saw in terms of a county impact. Is there any other questions or comments?
I don't see any. So, Rob, we thank you very much, okay?
Yep,
You have a
thank you.
nice day.
Thank you.
Thank you, Rob.
Is Janelle kicking around?
Janelle is here.
Janelle's here. We saved the best for last, Janelle. So, rock and roll. Go for it.
All right, good morning, everyone, and thank you for being here. Hopefully my agenda's short. I have 3 resolution requests. The first is to authorize a contract with Hadley Luzerne Central School to provide Committee on Preschool Special Education Services to Warren County children that are eligible. This contract will increase our availability of services for children in need. Services are provided at a rate set by New York State and are reimbursed at 59.5%.
Can I get a motion to put that on the floor, please?
I'll make that motion.
Edna Frazier, seconded by Supervisor Beatty. Any discussion? All those in favor?
Aye.
Onward.
All right. Thank you. The next 2 resolution requests are fiscal related, so I'll turn it over to Ton.
Attachment number 6 is our request for transfer of funds. And I've listed in the beginning, we have a nurse that worked in the home care. She is now assisting them in the public health right now, so I want to move it temporary. I need to move some money from our home care over to disease to pay for those salaries and benefits. That's the first set of entries. My second one is, again, COVID related. When we met last time, I was told we were getting another $7,700, which we are getting, that goes to our current, we call it bioterrorism grant. And so we have already spent that. They had told me at that time, I thought that we were getting another $24,625. I had put that in the same account, but come to find out that isn't the case. That's going to be a new grant, and it's really more like $27,000 and change. So I have to take all of this $24,625 that I had put in code 4191, which was what Rob Lynch created so we could keep track of this COVID separately, and move it to the second COVID code we created, which is 4192. We have been given by the state, they have told us now for the new grant, which 4192 we can tap right into, which we have already, that we're going to be getting $95,373 total right now. So I'm moving this $24,000 over to that, and that's what's going on with these transfers right now. So I don't know if you have to, or the next one, 7, relates to this too. I don't know if you want me to go to that or you have to do this one first.
Oh, why don't we just do them together if we can? So can we get a motion to move both resolutions?
Right, that would. And
Yes.
number 8, attachment number 8 is to amend the budget for the difference between the $95,383 that we're going to be getting and then the 24 I'm moving over. So I'm amending the budget to be $70,748 for this new code that's going to be only COVID related expenses. So that's related to the first one, like I said, the transfer. So I'm moving them over to this code, and then I'm adding this. So the total amount in 4192 code, which is the new COVID grant that we've got, is going to be $95,373 at this point, we've been told by the state.
Great, thank you very much, Tom. And we have a motion by Supervisor Shepler, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Aye.
Janelle?
All right, so with regard to referral and pending items, there are no pending items at this time, so we're moving into items for discussion and review. I'll turn it back over to Ton for attachments 1 and 2 for our financials.
Okay, attachment 1 is our current financials, and again, it's got some COVID information there. Our expenses are reflected year-to-date as of 4/14 is when I printed all of this. I will also note that we did finally get to bill our preschool program for the first ABL, which we did, and that was $816,000 $816,060.80. Also, administrative costs, we also are adding to 19 totals, just to let you know that they came in, and we estimated about $27,675 for that. So that came in, and those are reflected still in the 19. When I know when we ended 19, I always say we're going to get these, and we finally did in the spring. Regarding our current budget and the salaries below, most of the expenses regarding COVID at this point are considered overtime related, anything above and beyond their normal 8-hour day. And in our overtime category, we have $31,101. Last year it was $32,000, so we're under. But I just want to note that of that $31,000, almost $6,000 of it at this point was COVID only related. So we really were more like $25,000 in overtime if you look at our general category. So I just want to make you aware of that, because also that is fully covered by the grant, even though it's in our overtime categories. Then on attachment number 2, again, comparing last year to this year, again, the salaries, which I explained, and you kind of can see why that difference is, again, related to the COVID. And everything else is fairly reasonable. The only thing is our revenues, which are lower. I did want to note that obviously due to COVID-related activities, we are no longer running our public health clinics. Our MCH visits are limited, if any. Our home care visits are down because of census and because of we still have patients to see. Our nurses are still out there seeing all the patients and documenting. But again, right now at this point, that's reflective right there, which I'm sure everyone has got that to show. Benefits are consistent right now, and the contractual expenses are slightly lower, but they've been reflected due to COVID. They have some increases going on there. So we'll see more, obviously, when this was just up till really the beginnings of April, and we'll start to see more, obviously, as this goes on.
Thank you very much, Tawn. Janelle, anything else?
Moving on to attachment 3, that's our status of referrals. In February, you'll see that we were down 6%. We took a quick snapshot today to look and see where we're at just because of all the COVID activity for March. It's looking like we were down about 11%. But keep in mind with that, all elective surgeries have been canceled. Referrals are down everywhere. We are gearing up, if we get referrals from the hospital with patients coming home, for us to be able to react and provide service there. I want to send a special thank you to our nurses and the therapy contractors for doing an excellent job and, continuing to visit our families. So with that in mind, jumping to emergency response and preparedness, I'll try to give you an update to the best of my knowledge. All the activities that have been centered around COVID-19 response, pretty much through our emergency response and preparedness program and our public health side. We started with conference calls and trainings and informational meetings for mid-January through February. March 7th started our local activity because we had our exposure. For those of you that remember, it seems like eons ago, was the CVS exposure in Glens Falls, where we contacted over 500 families to determine their exposure. Our first active case in Warren County, we were notified March 17th of that. Seems like so long ago, but time has really flown by. With that, the COVID task force has been essential, and it's been an amazing resource to discuss ideas, plans, and issues that have come up. I feel so thankful to have that group as a resource to kind of bounce things off of. It's certainly a team effort, not an individual effort, and it's certainly a county issue, not just our department's issue, because in one way, shape, or form, it's affected every department. The public health ERP agency contracts, our plans that we've written and created over the years certainly have become useful as us having up-to-date contact information for different agencies and community partners. The collaboration with Warren County's administration and other departments along with community partners have been essential to our response efforts to date. Another very important factor is the amazing cooperation of the community through all of our quarantines and what we've been asking them to do. Staff with our health services is absolutely awesome and amazing. I'm just forever grateful and thank you to all of our staff. Just to give you a brief overview of our staffing in health services, a quick snapshot, we have 67 staff, all considered essential. In public health, that's around 25, which is 37% and a rough estimate for getting the little tenths of the points. Home care, we have 35 staff. WIC, we have 7. So of the 25 public health staff, which is the 37.3% of our staff, we have 12 working out of our office, which is 48%. Out of home, we have 10, which is 40%. A mixture, we don't have any in public health for that. We have 2 people currently out on leave in the public health side, which is 8% of the staff. And I do want to note that we have 1 volunteer that's been putting in 12 to 16-hour days, 7 days a week with us, and she contributes 4% of that public health response. With our home care agency, we have 35 staff, or 52% of our agency. Those working from home are 23, which constitutes 65.7% of our staff. Our office people are 10 out of home care, and that's 28.5%. Many of that office staff is administration and clerical support to be back up to the public health for help of answering phones. We have 1 person that's a mixture of home and office, and that's 2.8%. And we have 1 person in CHA, or home care, on leave, which is 2.8%. The other agency that we have under our department is WIC, also essential, and that we have 7 WIC employees. 6 of those 7 are from working from home. That's 85.7%, with the office being 14.3%. So I just kind of wanted to give you a feel for what we have. So with public health for the COVID response, we've been primarily relying on 12 office staff, or 48% of our overall public health staff. So with that in mind, looking at some of the activities we've done, we've transferred our WIC services from an in-person model to a by-phone model. We've continued with our home care agency services with our nurses working from home. We have our early intervention and preschool staff contacting families periodically by phone to check in, because these are families that typically would receive a lot of support. And now you've got children with special needs at home all day with families and, without a break. So we've been checking in there as much as we can. There's teletherapy services for the early intervention and preschool programs that started April 1st. We'll talk about that in a minute. And then as far as answering calls from the community, I'm still proud to say that our agency is able to continue to answer all phone calls in person, and we're able to return all calls within the same day. I think that's very important in keeping the public connected to any concerns. So I would encourage anybody that knows that there's people out there that have questions or concerns, feel free to have them come to our agency. We've also been answering calls from a multitude of other agencies, including other departments within the county. We answer calls from other providers. We provide case investigations on all lab positive and suspect cases. To date, that's over 100 cases. We've been working with facilities to provide guidance, resources, investigations as needed. Right now, we've been working on outbreaks in 2 different nursing homes and an assisted living community within our county. We've been evoking isolation and quarantines as appropriate. We've had 216 mandatory to date and 33 precautionary to date. Just to kind of clarify, the mandatory quarantines are either people that are isolated for having disease or presumed disease, or people that have been exposed to them. And the precautionary quarantines are people that have had exposures that are essential healthcare workers or essential prison guards or something like that, it's a looser quarantine, but our office still monitors those. With that, we've also been monitoring those in isolation and quarantine with phone calls and visits. for the 216 mandatory quarantines. Those are families that had to be visited for 14 days. We could not have done this without the collaboration of the Sheriff's Department and the County Attorney's Office. The Sheriff's Department has been immensely helpful, and I'm forever grateful and appreciative. They've been visiting all of our quarantines daily, and they've been helping make the phone calls daily, so I'm very grateful and appreciative of that. We also provide updates, educational materials, and outreach for various groups as we get information from the State Health Department. We created a solo shopping campaign. It became evident that the grocery store visit was the big family outing of the day, and we've been trying to encourage people to maybe only one person in the family go unless maybe somebody needs assistance. So materials were made and distributed to our Warren County grocery stores. We created a campground poster, flyer, and reporting form. In the event that the campground's open, we're discouraging recreation, but for those that are being used for refuge by campers, we worked with a task force, and we're working with the State Health Department that if those are open, to open at limited capacity, and we tried to set up a safe situation through a reporting process so the county could be notified of such visits so that we could evoke quarantines for those. We provided outreach and education for out-of-town families. To date, that's been around 75. And we've worked to create a testing location through collaboration with Glens Falls Hospital and partners from Warren, Washington, Saratoga, Hamilton, and Essex counties. Again, OES has been instrumental in this campaign, along with the task force, DPW, other departments. It's in an appointment-only capacity. To date, we've served 140. When last I looked, about 9:30 today, we had 24 appointments scheduled for today. We did another round of drumming up business with our providers on Friday. So we're expecting business to pick up there. We did receive more kits over the weekend, 100 from Warren County, 100 from Washington County, through the state that we're able to roll back into that program. Just a quick note on testing. This morning, or actually last night, I became aware through a little informal network of regional county health directors that there was some activity with antibody testing, and that was then on the news today, but that was totally taken by surprise by the county health departments. We were not notified of this initiative. In fact, last week we were told the antibody testing, although there was a lot of studies going on, a lot of those tests were not specific enough and had some flaws in them, and we're having trouble with FDA approval and things like that. We also heard rumor from the State Health Department last week that they were looking to test all nursing home residents and staff within 7 days. That was a little baffling to the counties because we haven't had a huge amount of testing kits, especially in the North Country. So on the call, the counties reached out to the State Health Department and said, can you please give us an update? How's this going? How is this going to happen? So we've been active in trying to get the information, but we didn't get any. After being on the news this morning and coming into work and all the counties pushing back to the State Health Department, I'll read the email that I received from the Office of Emergency Preparedness. Good morning. Yesterday, I'm sure many of you heard the news from within other channels of your county about COVID-19 antibody testing being conducted at grocery stores in the Capital District region across New York State today. This effort was not coordinated by the Office of Health Emergency Preparedness. There is limited effort for randomized antibody testing via finger stick blood spot. This is not diagnostic testing. It won't show if you have active infection to COVID, but it may show if you have antibodies. We have heard this and will be available for one more day today, April 20th, from 10 a.m. to 5:30 p.m. We are aware of the following locations: Price Chopper, 1 Kendall Way in Malta, Price Chopper 501 Columbia Turnpike, Rensselaer, Price Chopper 1640 Eastern Parkway in Schenectady, and Target at 60 Smithfield Boulevard in Plattsburgh. This information is rapidly evolving and may change. I encourage you to reach out to your local OEM officials for additional information. Couple things are concerning here. I did reach out to our Office of Emergency Services. They were not aware of this. And since this email has been sent, again, on my informal communication with other health directors, I've learned that 3 locations have quickly been closed with the assistance of the Sheriff's Department due to some chaos and mayhem there. Understanding that maybe the Plattsburgh might be the only place that they're offering this at this time, and that there's an hour and 50-minute wait for anybody that participates up there. So I just want you to know that this was something that counties were not made aware of. We've pushed back, we've asked to be included in that loop, and that is all I know on that particular topic. So continuing with other activities that we are doing, we've been working to fill in gaps as needed. Our current statistics as of today, or actually as of yesterday, we're still working on today. We have 100 lab confirmed cases. 56 of those are facility based. We've had 51 with mild, or that continue to have mild symptoms. We have 8 that are moderate. 3 of those are hospitalized. 3 of those are at home. 1 of those is in an assisted living, and 1 is in a skilled nursing facility. In critical condition, we have 3. 1 of those is in a hospital. 2 are in a skilled nursing facility. We have 4 people currently hospitalized. 33 have been recovered. Sad and very regretful to report, 5 unfortunately have succumbed to COVID-19, and our hearts at Public Health, and I'm sure with the county as well, our hearts, our thoughts, our prayers are extended to these family and friends of these people. It's very sad. We're hoping we don't see any more. But, you know, we're trying with our investigations to quarantine everybody that needs to be quarantined, isolate those that need to be isolated, offer testing as much as we can to those that are symptomatic right now, and to work with our county partners and community partners to try to contain this the best we can. Finally, again, not that I have a lot of information, but the state health department's, you know, kind of been reacting to the governor, talking about reopening. As things reopen, obviously they have to meet certain protocols, but when that happens, it has to we have to, as public health officials and as a county, be able to control the rate of infection and strengthen our healthcare system through increased capacities. We have to determine who are the more essential businesses that might need to open. Are there safer businesses that can reopen sooner than others? How can the private sector reimagine their workforce? So kind of in this absence of things being open, but in preparation for things opening, everybody should be encouraged to think of how they can do things to promote the social distancing, promote infection control, and kind of change their business model to keep some of this into consideration. So I imagine public health will be front and foremost in trying to help provide a lot of recommendations for a lot of different types of businesses. We also need to work to where people can continue to work from home if they can. And I think a lot of lessons have been learned about what can be done at home versus what can be done, you know, in an office. And certainly, as you look at staggering the workplace back into full operation, trying to keep those that can actually be working at home and productive at home as long as possible to help kind of create some of the distancing as people continue to get back together. As you're probably aware, the New York pause has been extended to May 15th. And I think that's all I have unless people have questions.
Yes,
The other thing that I like to say is public health has been doing also all those other jobs as needed to fill in the gaps. I just can't say enough how the health services staff has been amazing and awesome. I feel truly blessed to work beside them each and every day.
Thank you, Janelle. It goes without saying that your organization is at you're the front line. You're the people that on a day-to-day basis really deal with the real problems related to this issue. So we thank you for your motivation, your effort, and your continuing professionalism as it relates to hopefully an end to this situation. Supervisor Beatty.
Let me echo those thoughts from you, Chairman. Janelle, we can't thank you and your staff enough for the job you're doing. And that's just, you're the unsung heroes in this whole mess we're in. And personally, I thank you, and I'm sure every supervisor echoes that same sentiment. I did have a couple questions. Janelle, can you give us, with the older people, obviously, 90% of cases that pass away are from the older people with an existing condition. Can you give us an update on the 2 nursing homes? And the questions I have in specific, Janelle, is how many tests? Oh, well, I guess my first question is, are all individuals in these 2 nursing homes being tested? That's question 1. And question 2 is, if not, is it because we don't have enough kits? And question 3 would be, could the state provide those kits? Because obviously we have 2 nursing homes that are, I won't call the epicenter of the county, but are a main area where we're having cases confirmed. So I'll back up a little bit now, and I'll kind of let you take over.
So 56 of our 100 cases are facility-based. At our facility 1, we have 26 cases that were identified that are contained to 1 floor, as far as we know at this moment in time. We've had no new cases there. There still has been active testing. Facility 2, we're up to 20. That's dispersed throughout the facility. And then at our assisted living, we have 11 cases. To answer your question about is everybody tested there, we've been testing everybody that's symptomatic. And actually some people that are asymptomatic that were roommates of people, I think, have been tested, not universally, but when it made sense to do that, that certainly was done if testing kits were available. We had a conference call on a weekend. I think it was last weekend. I apologize, all my days are blurred together. When we first learned about our first facility, and one of the questions came up was, do we test everybody in the facility? And the question, or the answer, was from the state health department and the people that manage the nursing homes. From the state level, we're saying that didn't make a lot of sense, that we still needed to be operating under the same pretense of if they're sick or have symptoms, you test, and to do infection control and containment, and that, they'd be available for further discussion. I don't think that we've necessarily had a shortage of kits, because whenever the nursing homes have reached out and said they need to be tested, those kits have come from somewhere. All of our skilled nursing facilities within Warren County, the medical direction comes through providers through Hudson Headwaters. So they've been very gracious in providing kits to be able to test. I do know the hospitals helped out in a couple occasions of looking for test kits as well. And I think if we had to reach out to the state health department, we probably could. But the quick answer is not 100% of everybody within the nursing homes are tested, but sick staff and sick patients are tested.
Okay. I was taking notes as you were talking. So just to recap for my own sake and maybe others, only those that are showing symptoms are being tested in the nursing homes. Of the 100 cases in the county, 56 are from 2 nursing homes and 1 assisted living area. So 56% of all the 100 cases are from 3 facilities. Okay, but we do have the kits available if we needed to test even those that aren't showing the symptoms. Okay, but at this time, the State Department of Health wants us to continue with their current guidelines. Okay. Is that a fair recap?
That is. And I think it goes on the pretense that they don't feel that the test is valuable in identifying the viral load in asymptomatic people. It doesn't mean that you might not have an asymptomatic person test positive, but it's more likely for somebody with symptoms to flag a test. And one of the other things that the state health department told us is basically to assume once, the facility that we initially identified that had the 26 cases, or that has the 26 cases, I mean, we were basically told, even though those were limited to one floor, to assume that the whole facility had it. And at that point, just to treat every patient as COVID positive.
Okay. All right. Very good. Thank you.
Thank you very much, Janelle. Do appreciate that. Is anyone else? Claudia Bramer.
Thank you, Chairman. I have a couple questions if you'll allow me. Janelle, thanks so much for everything you're doing. Have you determined, or can you tell if Warren County has reached our plateau of the curve?
Well, I so wish I had a crystal ball right now, so I could answer that. I don't really know. I don't really have a way to measure that because a lot of our recent cases have been facility-based, versus community-based. I'm thinking that with intensity, if we multiplied what we have by 4, it's still technically manageable within Warren County. So it's kind of with hesitation and reluctance. I feel that if we did still see more activity, we can handle that. Not that I want to see that activity. I'm hoping that we don't see that activity, but there's really no good way to tell. I think we're just kind of in a watch and wait and try to be prepared to handle any additional cases if we get them. I'm kind of reluctantly hopeful that we haven't seen a lot of that extra community activity. We do have the ability to test right now. Anybody that calls their provider and says they have symptoms is being signed up. We've seen kind of, now that we've got to testing, we've seen a little bit of a dip there. Anybody that calls our office that works or that's part of an investigation that we're doing, if they're symptomatic, we're sending them right on to test. That's why we're not seeing an increase in our presumptive cases, because anybody that's symptomatic, we're testing. But I will say that even over the weekend, the positive cases that we got were pretty much all facility-based, not community-based.
Thanks.
And if they were community, it might have been like a staff member or something like that.
Okay. This might be a question for OES, but I had someone reach out to me over the weekend saying they have some 3D printed shields. Does Warren County want any of them? I can talk to you offline.
Very good. Any further questions or discussion? Claudia.
Thanks, Chairman. One more. Janelle mentioned about working together to determine what our essential businesses are. Do we have a process set up for that? Is that being handled through the COVID task force? And what kind of influence do we have with respect to getting the governor to put those on the executive essential businesses list? That's all from me. Thank you.
I could do my best with that one, Mr.
Go ahead, Ryan. Yes.
I've had a couple of businesses reach out to me for advice on whether or not they're considered essential. For the most part, you can answer most of those questions by going to the ESD website. And I found that they update that. They have been updating it over the past couple of days, once every couple of days. I think the last time they did it was, actually, I have it right on my other screen here. It was last updated at 9:45 a.m. yesterday, the 19th. Just refreshing the page. Yeah, that's still the most recent update. And there are directions at the bottom of that page as to who is allowed to apply for an exemption. They've already factored out a bunch of categories of businesses that cannot do that. In some cases, there's gray areas where, give you an example, the GFK9 is open for and dog places like that, not to promote one over another. They're open for daycare and animal care. And there's a question as to whether or not grooming is considered animal care because it's not spelled out in those regulations. And that's something that the governor's office clarified on a phone call with the Capital Region leaders, if you will, towards the end of last week. So it's every business, they should take a look at that. And if they can't figure it out, they can get in touch with the ARCC or they can get in touch with their supervisor, and we can work with the state to help them figure it out.
More, Claudia, another
Sorry,
question?
I was thinking more like going forward as we start to suggest, okay, here's maybe a category of businesses that we think are safe to open for our area, like what they just did with the boat launches and stuff, which by the way, I would hope that we get our boat inspection stations open too. But anyway, yeah, that kind of thing, not so much on a narrow.
Yeah, I think it would be reasonable for us to make those kinds of recommendations, and the state is listening. It's going to be up to the state as to whether we can do that sort of thing, because we're all right now under the governor's executive orders, and unless he wants to start making regional exceptions to those, the ball's in his court. But I do think that it's appropriate for us to make those advocacy points.
Thank you. Did Supervisor Beatty, did you have a question?
Well, yeah, I think Administrator Moore answered it. It was similar to Claudia's question in that from the way I perceive this, we can make regional suggestions, but it's ultimately the governor who's going to make the call on what businesses he's going to deem essential and not to open up. So, but that being said, I do know that he does listen because he was getting significant feedback about marinas, golf courses, other issues. And I think he modified his position on a number of them because of the feedback. So although we as a county don't have the ultimate say on what businesses get open or not, we do have an impact in the sense that if we send a consolidated message to look at it more regionally, I think he'll give that hopefully its due diligence and put that into the equation. So that's how. Am I right with that, Ryan? Is that
Yeah, I would agree with that. They've been very reasonable to work with. ESD has an open line. It can sometimes be tough to get them on the phone because they're taking these requests from all corners of the state. But Mike Morris, also in the governor's office, has been fantastic. Whatever we need, he's on it.
Okay, thanks.
Yep.
Any further discussion? Great. And Ben, you? No? Okay, great. Can I thank you very much, all. Good discussion. Can I get a motion to adjourn? Supervisor Shepler, seconded by Supervisor Frazier. All those in favor?
Aye.
Thank you. Meeting is adjourned.
If I can't get it, my dog sure.